My name's Amanda, and I'm a mom with a child with intellectual disabilities. When Brenna was first born, she was just like your average baby. Everything was just what you'd expect a baby to be. Be little signs that something maybe wasn't quite right. She wasn't reaching her milestones. She wasn't doing the things that other babies were doing at her age. It wasn't until she was 2 that we figured out that she was different. When we first got the diagnosis of the chromosome disorder, there was part of me that was just relieved that finally it was almost like the feeling that I had a name. You want your child to be unique, and you want your child to be their own individual, but nobody wants something to be wrong, and nobody wants something to be different that's going to make their life more difficult. What's really, really important about having the diagnosis is you desperately need that piece of paper in order to get the services and open the doors to get the help that you need. Not everybody knows the best way to get to know Brenna, and it's a little bit more difficult to get to know her. So you have to work a little bit harder, and that makes life a lot more challenging. People just aren't as accepting, and there's a fear associated with it. What I find very, very difficult dealing with people in the healthcare system is the main part is they always want me to answer the questions. So they say hey to Brenna, and then they talk to me.
If there's question for me, they will. If I know it, they will talk to me. If I don't know it, they will talk to my mom.
Brenna is very engaged. She has great advocacy skills. You know, she's very verbal. Okay, Brenna, I'm going to take your blood pressure.
Okay.
Would you like me to do it in your right arm or your left arm?
Left arm.
All right. And now you can press the start-stop button. If we had just written, let's say, intellectual disability on her chart, then people could pick that up and think, you know, maybe this child doesn't even speak. And then she wouldn't be as engaged, I think, between the healthcare provider and herself.
There you go. Yeah, all done. It's important for healthcare professionals to be involved and to develop relationships, because children with intellectual disabilities spend more time in the healthcare system than your average child. We see about 9 different specialists regularly, and Brenna's not even sick.
I think it's really important for families and for parents and caregivers to see that we do communicate and interact with the children. We do that with all our clients. You know, it doesn't matter what their diagnosis is.
When people address Brenna first, and when they talk to her first, and they walk in and say, hey Brenna, and I'm the second one, you can just see how much more important she feels.
It is so important to create a relationship with the family. We may only have 5 minutes, but that 5 minutes is so crucial to the care that we're going to provide that family.
We may be slightly different than many families, but we are still just a family. Even though Eric may not be able to communicate to himself very clearly, that he understands and that he fully appreciates when people talk to him just like any other child. It also makes his day when the nurses draw a little happy face on the bandage, something very, very small that really takes no time whatsoever, even when it's busy in there, but it makes a huge difference for Eric.
Even at the end of a procedure, getting a popsicle is a really huge deal for a child.
Incredibly important as a nurse to create that relationship and that trust and build that rapport. One of the first things that I do with families, even if they are nonverbal, is I ask that family, what is the best way to communicate with your child? I was working in Emerge, and a family had come in, and the son was very low functioning and nonverbal. And I know the dad was very, very, very tired, but I asked him, I know you're tired, but can you tell me one thing that your son really likes so that I can communicate with your son and create that trust? He told me that the ball was something he really enjoys. I called labor and delivery, and I got a ball, and I created that relationship.
I have to start every appointment with telling everybody our whole story. It can really eat up a lot of time and make it a lot less efficient.
We know that families are asked the same questions over again and it becomes incredibly repetitive for them. It's very important for healthcare professionals to write this information down in their chart so we don't have to ask the same questions again.
In regards to an individual who has a developmental delay, and for us to communicate that to other healthcare providers, it's certainly much better to write a detailed report. You can write, please see psychological assessment, and be a little bit more detailed.
As healthcare professionals, we can help one another in cases where kids communicate in different ways. For example, if I know that a little boy likes blue, I can tell that healthcare professional, bring blue, or a ball, bring the ball.
That there might be a few adaptations that the healthcare providers have to make along the way, but really they're fairly minor. Little differences go a very long way. Listening to us and helping us to have an appointment that goes very smoothly makes a huge difference. Makes a huge difference in the children even wanting to come back to the hospital, and that is very, very important.
Try other nonverbal ways to communicate with the child.
Ask the parents what's their child's favorite toy.
I am most frightened when
Ask the parent the child's level of understanding.
Explain procedures to the child, not just the parent.
Document information and share with your colleagues.
they focus on me.
Take your time and be patient.